Here, we had historically we had a very keen focus on 7-day working, and that was particularly supported by our previous chief exec, who'd been involved in the original working party that set the 10 clinical standards. So he came with a sort of an interest in the subject, and that was helpful for us.
I would imagine as well, because we're a system under so much pressure, that actually to get those services running 7 days a week was sort of imperative to try and relieve that pressure on the system in terms of emergency admissions. So I think that's been a massive driver as well.
I wouldn't want to think that the introduction of the standards has been what's driven this. Is something that we started some time ago, and I think that's one of the reasons we perform reasonably well on things like the senior review. We've built that systematically into our way of working, and I think that's just been the way we've worked here. I think one of the key factors is we're a large organisation, so we've got a large body of staff that allow us to provide 7-day cover with effective rostering, and I think that challenge has been taken up.
I think for me, the way, and I know we've got some way to go, like Alan just said, in terms of weekend discharges, but decisions can be made out of hours now that maybe traditionally were made, Monday to Friday, 9 till 5. And I think if it helps the flow of patients through the system, maybe reduction in length of stay, I think that's sort of where I was coming from.
I think the biggest challenge really has been getting it into the urgent and important box, because most people, it's one of these things that when we have to do the surveys, etc., things like that, there's suddenly a lot of interest in whether we meet the standards. But I think in most people's day-to-day lives, it's not something that's at the forefront of their priorities. So I think that's probably the biggest challenge, is to get people to engage with the whole 7-day services agenda. When throughout the year, rather than just when people are asking awkward questions.
You do see that continuity of care now through the weekend, so the delays are reduced, so you're not waiting, you've seen the same consultant that you saw Monday to Friday on the Saturday and Sunday, so I think it's definitely increased continuity of care. And I would say for the staff out on the wards, and nursing staff, healthcare staff, to be able to know that you've got consultant cover over the weekend must benefit the decisions they're making also. So from our point of view, we saw a continuity and also a reduction in delays or waits.
Yeah. Well, I think one of the key initiatives that we've pursued under this heading really has been to invest in diagnostic capacity at weekends and out of hours, and I think again that manifests itself as sort of really reduced waits for patients who need imaging investigations, for example, at the weekend. So I think that's an actual thing we've done, and with targeted investment in those areas. That would be where the main benefits would sit. Patients who are here at the weekend, they're being well looked after. We've still got some way to go in, for instance, increasing the proportion of patients that are discharged at the weekend. That's we've still got a very clear weekday bias towards certain activities. But I think certainly nobody who needs an imaging investigation at the weekend is waiting till the following week.